Welcome back to CBS Mornings, where we are learning about a type of health insurance that can lead to unexpected medical debt. And speaking of debt, 100 million people in America are saddled with health care debt, according to a KFF study. And that includes, believe it or not, people with health insurance. Our series, Medical Price Roulette, looks at how one Tennessee family potentially faced hundreds of thousands of dollars in medical bills, even though they thought they were covered by their insurance plan. Consumer investigative correspondent Anna Werner has their story. Anna, good morning.
Good morning, Tony. Yeah, so let's say you have a job. It comes with a health insurance plan and your family's doctors are in the plan's network. But suddenly, in an emergency, maybe they're not. That was the scenario faced by one family in Chattanooga.
Stop it. 53-year-old Joe Smith is a father of four and a runner who seemed perfectly healthy, his wife Stacy says, until one night in February at the dinner table.
He was saying things that weren't making sense, not putting information together properly.
At the emergency room, she says, doctors could find no clear cause for his symptoms. But what a CT scan did find, a brain aneurysm.
As soon as they said the words brain aneurysm, I mean, that's terrifying.
I just knew that if you had one that's usually something that ruptures and you don't make it.
Put in there.
Within days, a neurosurgeon confirmed Joe would need surgery as soon as possible to prevent a life-threatening rupture.
We knew that he kind of had this ticking time bomb in his head.
The surgery was scheduled for a Monday in March, but the Friday before, the doctor's office called. The surgery had to be canceled because the Smiths' health insurance company was refusing to pay for it. Why the denial? Joe's health insurance, through his job, Blue Cross Blue Shield of Illinois, said that local neurosurgeon, Dr. Mayshan Giassi, who specialized in brain aneurysms, was out of network. And the Smiths' health insurance provides no coverage for out-of-network doctors and hospitals. The insurer calls it a high-performance network, or HPN, but they're generally called closed networks, with cheaper premiums for employers and employees, but zero out-of-network options. Georgetown University professor Sabrina Corlett studies health insurance reform.
Some employers are increasingly introducing these closed network plans or narrow network plans as a way to cut back on their healthcare costs.
So Stacy Smith went looking for another neurosurgeon anywhere near their home in Chattanooga, Tennessee, who was in that HPN network and could perform the surgery. She couldn't find a single one.
I spent all day Monday, I think, in tears on the phone with anybody who would listen to me at the insurance company saying, look, he needs this surgery now. What do we do?
And what'd they tell you?
I'm sorry, there's no policy. There is no protocol. There's no plan.
I mean, you were staring down the barrel, essentially, right?
Yeah, it was very scary.
What was the greatest fear?
That he wouldn't survive, that it would rupture before we could get the surgery.
The day after the canceled surgery, the couple say, Joe developed a persistent headache and went to the ER. The next day, Dr. Giassi performed emergency surgery.
How lucky is he that this was even caught before the aneurysm ruptured?
Yeah, extremely lucky. There's a lot of the people in this country that don't have that luck, and they are not treated in the manner that he was.
But when we sat down with them 2 weeks after the surgery, the couple still didn't know whether the bill, possibly hundreds of thousands of dollars, would be covered.
Is the insurance company going to pay for that or not?
We don't know.
Nearly a month after the surgery and after we contacted the company, Blue Cross Blue Shield of Illinois sent the Smiths this letter saying their request for Dr. Giassi to perform surgery had been denied in error and it would now be approved. The company later told us it couldn't comment on Joe Smith's case, but said in some situations where an in-network provider is not available, a member may receive services from an out-of-network provider.
And this speaks to the need for some basic standards for how quickly a plan has to review and act on a request for authorizing this kind of a service. But right now, unfortunately, a lot of these insurance companies think that they can save some money by dragging their feet in this manner.
In fact, we found that in March, the same month Joe Smith was waiting for his surgery, the state of Illinois fined Blue Cross Blue Shield of Illinois over $600,000 for violating state laws, including failing to properly apply maximum driving time and distance standards to reflect the actual number of providers available. The insurance company told us it's committed to helping our members access the care they need, where and when they need it. But Joe Smith says,
I don't like them having that kind of power over people's lives. that, you know, they shouldn't mess around with people's lives and, you know, push it off, deny.
Do you feel like the insurance company put your husband's life at risk?
Yes, absolutely. Absolutely.
Well, Joe Smith recovered from surgery. He's back working full-time in his job as an appliance and air conditioner repairman. Beyond the hospital costs, the Smiths were worried about follow-up care, all of which is now expected to be billed as in-network.
Which means it'll be covered.
Covered.
We think.
Right.
Okay.
That's what they're now being told.
Yeah, but imagine the predicament they're in. They need the surgery, and you're told, nope, it's not covered, so sorry, nothing we can do. That just makes no sense.
Right, and she
in this
spent
country. When you've been
hours-
paying all the money for the insurance.
Yeah, and she spent hours and hours
I
on the
see.
phone talking to one person after another. We've all done this, right?
Yes.
You call, they transfer you to somebody else, you call
Yes.
again, then
You're
somebody
on
says they're gonna
hold.
solve the problem.
Yes,
You're on
yes,
hold.
yes.
And, you know, meanwhile, trying not to stress her husband out
Yeah.
because she's worried this thing will rupture.
Do we believe that this is going to create
Terrifying.
change for the better when it comes to these insurance
It
companies?
did in this one case, it would appear.
Yeah, I mean, you would hope. You know, it's tricky for consumers, right? Because they checked to make sure their doctors were in network. They
Yeah.
were, but then something unexpected happens, and in that situation, can you control what will happen? Unfortunately, in many situations, you're not in control,
Not in control.
and then you wind up, you know, rolling with whatever's happening.
Also, Anna, on the phone, just trying to find a random doctor who could do this,
Right.
as opposed to a doctor that you know and you're familiar with his skills.
Yep.
Can anybody do this surgery? That's not right either.
Right about that. Anna, thank you so
Thank you,
much.
Anna.